All right, thank you, Mindy, and thank you everyone for joining us today. I am happy to be here talking about a topic that I am passionate about and would love to talk more about. So today we have a few things to cover. First, just a little bit of background on what a geriatric horse is. What does that mean to be geriatric? Then I'm going to talk about chronic pain, how we identify chronic pain, and how we manage chronic pain in geriatric horses. And then one other area that I think doesn't get talked enough about is talking about end of life and talking about end of life way before in anticipation of actually making those end of life decisions. So one topic is, when is it time to euthanize your geriatric patient? How do we know when it's time to euthanize? And then what does euthanasia mean? How do we euthanize horses, and what do we do after the horse has been euthanized? So first, what do we mean by geriatric horse? When is a horse considered geriatric? So there are a few different ways that we define age. Chronologic age is just your actual age, what's on your birth certificate, what's on the birth certificate, year you were born until now. But as we know, that doesn't necessarily capture what that really means. I like to think that I'm younger than my true age, but that might be just wishful thinking. Physiologic age is your age based on your functional capacity. So basically, what that animal is relative to what they've started out with, and are they at their peak, not at their peak? Senescence means past your capacity for peak performance. I'd like to think that I have not reached senescence yet, but in reality, I am past my past my capacity for peak performance, but that's going to really differ horse to horse. And then demographic age is basically where you are relative to the population and survival rates. So that is another thing to consider. For horses, the current accepted definition is any horse or pony that's 20 years of age or older. It used to be 15, so some of the older studies or older papers will use age 15, but I think all of us probably recognize that a 15-year-old horse really isn't old in most cases. And so usually now when we're talking about geriatric, and what I will be referring to today is any horse that's 20 years of age or older. So as we know, the modern domestic horse is living longer. It's not uncommon for me to see horses in their late 20s. Many horses are living to 30, and even reports of horses living beyond 30 into their 40s and even 50 I've seen, which is great. If you look at USDA data, kind of looking at all the horses in the country, we know that the most recent data is really 2005, so a little bit older now, but in 2012, we had 3.6 million horses in the United States, and almost 8% of the horses were 20 years of age or older. So that's 300,000 horses in this country that we're talking about. So it's a big population that needs to be considered. All right, moving on to our topic of the evening. So chronic pain. How do I identify chronic pain? So we know in chronic pain in people that we definitely have a lot of studies looking at the ramifications of chronic pain, and have found that it's associated with anxiety, depression, and decreased quality of life. There's some interesting studies and that have shown kind of all of the negative things that happen when someone is experiencing chronic pain. We can just extrapolate to horses and assume that chronic pain affects most or all geriatric horses to some degree. We just don't have any actual studies looking at chronic pain specifically in horses, or kind of all of the potential negative side effects of that. But we do know that chronic pain or perception of chronic pain frequently contributes to why people ultimately decide to euthanize their horse. There are a few pain assessment scales that have been developed in horses, which are really nice to have to take something that's a little bit hard to define and try to give it a number. The problem is that they're really typically focused on acute pain. So that pain kind of within a hospital setting, after surgery, or with acute laminitis episode. They're not really designed for at-home use. So really designed to be used by veterinarians or veterinary professionals, like technicians, within a hospital or research setting. And they're scored by veterinary personnel. It's really hard to measure chronic pain. There's really no one presentation of chronic pain. We do know that acute pain and chronic pain are not the same. They're going to have different clinical signs. They're going to be more subtle and dependent on what's causing the chronic pain. A lot of it is dependent on the horse as well. We don't have as distinctive clinical features that we know are indicative of pain when we're talking about chronic pain. It also is important to consider who's doing the assessment. Most of the time with chronic pain, we want to have, it's going to be owners assessing. It's going to be you, horse owners, who see their horse every day, because those pain things are going to be things that we're going to be measuring over time, because it's chronic. It takes a long time to develop that ability to recognize or know what's normal for that horse. So some common sources of chronic pain in older horses would be osteoarthritis. So that's something we kind of assume every horse. I teach students that all horses are lame. It's just how lame and where. So assuming most older horses are going to have osteoarthritis affecting at least one joint. Endocrinopathic laminitis. So by this we mean laminitis that's caused by endocrinopathy or kind of a hormone-related disease. And the most common one here is PPID or equine Cushing's disease. That is definitely something that is increased likelihood with age of the horse. Also, equine metabolic syndrome is another endocrinopathic laminitis. It's not related to age. Navicular syndrome, foot pain would be another source of chronic pain. One thing that is important to recognize, and I've kind of realized as I've gotten older and wiser, is that not everybody connects in their mind that lameness equals pain. So when we're doing a lameness exam or we're saying a horse is lame, that means that horse is painful. That's a kind of a limp, or the pain is the source of the lameness in most cases. So we use this AAP lameness scale, and I put it here just for your reference, from 0 to 5, with 0 being not lame and 5 being non-weight bearing, like the horse will not walk on the leg, it hurts so much. There's also a lameness grading scale for laminitis. And this is specific, kind of used to help distinguish at what point is the horse lame. Are they lame at a walk? Are they lame only when we're doing complicated, asking them to do lunge in a circle on soft ground, trying to give it a better characteristic of how much pain they're suffering from. One thing that's important is that we know that in chronic pain, it's going to really rely on owner recognition, as I mentioned. But horse owners are really not necessarily good at recognizing pain. And that's, again, because when you're looking at your horse every day, it can be hard to see those signs. And we're talking about chronic pain, they can be more subtle. So there's been one study, actually, that's very interesting, from the UK, and it was back in 2012. And they looked specifically at horses who are 30 years of age and older. So kind of our super geriatrics. They had almost 70 horses in this study. So first they did an owner assessment, just asking them about their old horses, and 15.7% of the owners reported that their 30-year-old plus had been lame in the past year, but 64% reported their horse had stiff joints. So then they had the same horses, the exact same horses, assessed by a veterinarian, and when you looked at the same horses when a veterinarian looked at them, almost 80% of them were graded at least 3 out of 5 lame. So that you can see that on the scale. So basically they're lame at a trot consistently. And over a third of those same horses were grade 4 lame. So lame at a walk. So this is just, I show this to demonstrate the discrepancy between what you see as a horse owner versus what you see as a veterinarian, and really kind of come back to the importance of having veterinary assessment of our geriatric patients, because there's this disconnect sometimes between, well, that's just the way they walk, they're just getting old, they've got stiff joints, and a veterinarian who recognizes that as a manifestation of pain. So assessment of chronic pain, we know it relies on owner and veterinary recognition of pain. Sorry, mistypo there. We also know that geriatric horses are likely to suffer from chronic conditions causing pain, like osteoarthritis. And then we also know that geriatric horses are less likely to receive veterinary care than non-geriatric horses. So there was an interesting paper recently in 2018, and it's just, again, another survey of horse owners, and they had a lot of horses in this study. They were comparing geriatric or 20 plus with non-geriatric horses, and just looking at this table just shows kind of what veterinary procedures were performed on those horses in the previous year. And the things that really stand out here, so we're looking at this p-value over here on the right, the far column. And really that just tells us that that was a significant difference between the older geriatric horses and the non-geriatric horses. And the ones that stand out to me are really I'm going to highlight here. So a lameness exam. So non-geriatric horses were more likely to have a lameness exam in the past year, and this is very significant, than geriatric horses. So non-geriatric horses more likely to have a lameness exam. Non-geriatric horses were also more likely to have joint injections, and that was important. And non-geriatric horses more likely to have kind of alternative therapy or body work, such as massage or acupuncture. So this kind of just demonstrates a significant difference between veterinary care that would cover these things that we're talking about. So arthritis, chronic pain is less likely in our geriatric patients. In this same study, they also looked at kind of what factors owners use to decide whether they are going to provide veterinary care for their geriatric horses. And what I think is really important here is that we can really say that we know that owners really care about their geriatric horses. This is not for lack of care, lack for emotional attachment. The number one thing that influences veterinary care for geriatric patients was whether the horse is going to be able to lead a quality, comfortable life. So that's the most important factor that owners report. Also here is kind of horse age. Horse age was not a factor. So it wasn't necessarily as important how old the horse was in terms of whether they would pay for veterinary care or not. It was less important than the comfort of the horse. And then veterinary opinion was highly ranked. So this is a plug. I know there are veterinarians listening today as well, but that just demonstrates that the veterinary opinion, the veterinary's relationship with the owner helps to influence whether that geriatric horse got care or not. All right, so now we're going to move into how we manage the chronic pain. So there are a few kind of different areas: systemic therapy, local therapy, nutraceuticals, and body work that I'm going to briefly go over today, because this is a very large topic all on its own, and it's something that definitely should be a conversation between you and your veterinarian. So the first kind of systemic therapy is our non-steroidal anti-inflammatory drugs. So I'm just going to say NSAIDs, and we're all very familiar with these. This is the most common thing we use to manage pain in horses because they work well. They provide analgesia through decreased inflammation. So they are anti-inflammatories. They only are going to work for pain if the pain is coming from inflammation. And this is not true of all kinds of pain, but it's true of a lot of the pain that we are treating. So there's lots of studies out there demonstrating that NSAIDs are effective. We all probably anecdotally know that NSAIDs are effective at decreasing pain. So the approved products, there are quite a few products approved for horses in the United States. We're familiar mostly with flunixin, which is Banamine. So Banamine and Bute, also Furocoxib, which is Equiox. There are a couple others, so ketoprofen and dipyrone, that are less commonly used. So we'll kind of stick with the big three are Banamine, Bute, and Equiox. Other medications you might see are meloxicam, which is another NSAID. It's just not FDA approved for horses, and then aspirin. So one thing's interesting, there's not really many studies looking at NSAIDs and their effect on chronic pain or chronic lameness. Furocoxib is the only kind of FDA approved drug that has chronic lameness on the label. So it means it's they had to show that it worked in order to get that put on the drug label. And this was a chronic osteoarthritis study, and they just basically said chronic use then was 14 days. So many of you out there maybe have horses that are on Equiox and they've been on Equiox for weeks or months or even years. There's no studies kind of looking at that. The study that got that drug approved was for 14 days. So that was this study, and they basically showed that within that 14-day trial, with the things that they were measuring, that it was equivalent in efficacy as Bute given once a day. So there's some issues with this study, but this is the study that got that medication approved for use and demonstrated that it is effective for chronic arthritis. One thing to note about NSAIDs is that they have been associated with multiple adverse effects. And we know this. Most people kind of are familiar with the adverse effects of NSAIDs. But one thing to remember is that the same mechanism that makes them cause pain relief is the same mechanism that causes the side effects. So the safer the NSAID, the less effective it is at pain control. So that is just something to keep in mind when we think about the safest NSAID versus the most effective NSAID. So the risk of adverse effects can be different from horse to horse, but the no NSAID is without risk. So the main side effects that we're concerned about with NSAIDs are GI ulcers, and specifically the stomach and then right dorsal colon. So this is a cause of ulcerative colitis, the only cause of hindgut ulcers in horses. So despite what you might have heard otherwise. So not all NSAIDs have the same risk. We know this. Phenylbutazone definitely, or bute definitely has the highest risk of adverse effects. Vanamine is better than bute in terms of GI side effects. Firocoxib and meloxicam are the safest for long-term use in terms of the GI tract. And there have been multiple studies that have shown this. NSAIDs also can affect the kidneys. And this is really when horses are dehydrated. This is why we need to be very careful with using NSAIDs in horses that are dehydrated in the summer after, if they've been colicky and really sweaty. We have to consider this before we give an NSAID. And it doesn't matter which NSAID, they all have similar risk to the kidney. Gabapentin or pregabalin is another drug you may have heard of. It's kind of focused more on neuropathic pain. It's not labeled for use in horses, but it is, an option, and it's something that is not cost prohibitive that we can use in certain situations. The issue is that because it's a human medication, it's not really designed for the horse stomach, and it doesn't have very good bioavailability, which means that not a lot of the drug that we give actually makes it into the bloodstream. We also know that there's increasing human abuse potential, so that it is kind of getting increasingly restricted in human medicine in terms of how much we can dispense, and kind of the human pharmacies are tracking it a little bit more. We also know that it can be used to cause sedation. So in terms of using it under certain circumstances, depending what your horse does, showing performance, it is going to definitely have a restricted use. One interesting paper on gabapentin was actually done here, not done here, but done by our own Dr. Jenna Young. And this was actually looking at gabapentin for chronic pain, which is one of the few efficacy studies out there looking at horses with chronic pain. And they were comparing gabapentin to Equiox, either alone or in combination together. And they found that basically gabapentin alone had no effect on the chronic lameness, and that using gabapentin with firocoxib was no different than using firocoxib alone or using Equiox alone. So not a very convincing study to kind of get us using gabapentin in this situation. Tylenol or acetaminophen is another drug you might have seen is becoming more frequently used. We don't really know how it works, which is interesting. It's been around forever, but no one knows the exact mechanism of action. But we do know we can use it with NSAIDs, and they do it in humans all the time, and that you can stack them or use them simultaneously. We do know that in people, there's a big risk of liver failure or damage, and we have seen some evidence of that in horses, but we really have so little information on Tylenol or long-term use of Tylenol and the safety that it's kind of still up in the air as to how feasible it is. Opiates are another class of drugs that you can use to treat pain. They are centrally acting, so we probably all know this as well, is that opiates can cause you to feel good, whether you have any pain or inflammation or not, and this is why this is concerning in terms of being able to use it at home. But there's not really much information out there in horses for pain, surprisingly. And a lot of them are just focused on whether they even get absorbed into the bloodstream. So that's pharmacokinetics. But maybe there's some use as part of multimodal therapy, so using it in combination with other things. Again, when you have your gabapentin and your NSAID and your opiate all on top of each other to try to manage pain. However, it's kind of unrealistic for use at home because of the issue with human abuse potential. And also, when we're talking about horses, we're talking about huge amounts of drug, and the pharmacists get a little bit wary when we're prescribing things like that, where they're giving a lot of pills to be at home with how big of an issue the opiate crisis is in human medicine. It also has a lot of adverse effects. So the more you use it, the better, the higher doses you use, the better it works. However, you get a lot of GI side effects, and it has a high risk of causing colic. Local therapy is something I'm sure many of you are familiar with, but we don't have actually a lot of studies that look at long-term management of pain. Most of the studies focus on return to use. So this includes joint injections with corticosteroids, surgery, so to arthrodesis, so to fuse the joints, and topical NSAIDs, so diclofenac, That is there's actually very few studies on diclofenac, and I haven't seen many lately, but these are all options. Again, they really don't focus on using these long-term and long-term management of chronic pain. Chronic foot pain is definitely something that is an issue in our older horses, and oftentimes navicular syndrome or laminitis. This is where podiatry is really important. So working with a skilled farrier to help kind of provide support and pain management in the foot itself in terms of special shoeing or pads or trimming styles. Surgery can also help here depending on, again, what the situation is. The nutraceuticals are another thing that we hear a lot about in terms of a lot of supplements out there that are being marketed towards chronically painful conditions in horses. But one thing that we know about nutraceuticals is that there's no FDA regulation. It's not like a drug, so they don't have to really do anything to prove the drug works or that it has what it says it has in it. So there often are studies that they tell you they have, but if you really read the study, they're poorly designed and misleading. Glucosamine and chondroitin does have a few studies that were published in peer-reviewed journals, but depending on which study you read, you'll have completely conflicting information as to whether it helped or didn't help. Omega-3 fatty acids are something that I recommend because there is some data that says they're anti-inflammatory, but nothing really specific in horses in terms of chronic pain management. Again, same things with, you'll see celery seed out there as another supplement. Devil's Claw, I mentioned that one here because I hear about people using that a lot. This is what's in Buteless, and it's an herbal supplement. There's some data in humans, but in horses, there's one study only, and it says that basically, yes, it gets absorbed, and there's no obvious side effects, but they weren't looking at all whether it was effective or not. Cannabinoids, I get asked about that as well. So CBD products, those are nutraceuticals. Therefore, they don't have any regulation in terms of whether they work or not. So it's kind of use at your own risk. Most of these things are at best harmless, and if they seem to help your horse, that could be real or it could be placebo effect, but it's probably not going to hurt your horse. Cannabinoids is an active area of research, though, so we'll kind of keep our eyes on that as to something, whether that becomes a more promising area of pain relief. Other modalities, chiropractics, acupuncture, massage, physical therapy, those are all things that can be tried as long as you're working with someone who is trained in horses and they can legally do the things they're advertising. Acupuncture is the only one that has some studies behind it. And again, it really depends on which study you read. Some of them show positive results of acupuncture and some of them don't. There are some issues with some in terms of the study design, but one thing that they consistently show is that you need regular or repeated treatments in order to be effective, and that translated to multiple times per week. So acupuncture multiple times per week is going to be something that's not feasible for most people in terms of long-term pain management, but if you could, it certainly is something that you could try at home. So when you're managing chronic pain, I think it's helpful to make a management plan. So we start with identifying the goal for the horse. Is your goal to have a pleasure horse? Is your goal to go back to a performance? Or is your goal just to have a comfortable pasture pet? Like that is very important conversation to have with your vet and to be honest with yourself. It's also important to recognize the need for frequent reassessment by your veterinarian, given kind of your limitations in assessing pain in your own horse, which is the true for anybody. I think even a veterinarian's personal horse, they'd probably have trouble assessing pain, chronic pain, if they're seeing their horse every day and you kind of accept what you're seeing. It's harder to see those subtle differences. You want to intervene early and think about your pain control plan as an escalation. We don't start at the very top. We kind of work our way to based on what the horse needs. And then remember, your veterinarian needs to protect their license. So they have to be careful with which drugs they prescribe and how much in terms of being able to continue doing their job. So here's just an example I use of kind of an escalating plan for chronic pain management and kind of the hurdles that you experience at each step. So on the bottom here, we have our adjunctive therapy. Those are things like body work, nutraceuticals that can be used anytime. They're not really going to hurt anything. You can start with that and see if that's enough. If that's not enough, I recommend periodic NSAID use. So short periods of time, 3 days increments to help with if you have a flare-up of your arthritis, for example. Adverse effects here to think about, we talked about the GI tract and the kidneys. So if that's not enough, then you can add some local therapy. So joint injections, those type of situations, your Adequans, your Legend, that kind of thing, you could add those in and see if that is enough to help with your chronic pain. If it's not enough, maybe you would consider talk to your veterinarian about adding gabapentin. That really depends on where the pain is coming from. But again, you have to consider we're adding in potentially some human abuse potential. That is not working, you can maybe add Tylenol. Maybe consider adverse effects on the liver, but that would be potentially an option. And then kind of our last resort here is considering a controlled substance. However, that would be something like an opiate. Some people are using ketamine for chronic pain. The concern there is that I would be very uncomfortable leaving those drugs on the farm for it to be used. So it might be something where if your horse needs a a vacation at the hospital to get their pain under control, or considering whether if this is where we are on our pain escalation in order to manage pain, then maybe we need to have that talk about euthanasia. So we're going to move on now to discuss euthanasia a little bit further and really think about how do we know when it's time to euthanize our old friends? And then we'll go into how we actually do that. So when is it time to euthanize? So one thing that is, as a veterinarian, is my privilege is to be able to provide euthanasia for my patients. And this is something that is hard for some people to understand, but I think most horse owners and people who care about animals recognize euthanasia as a privilege. Euthanasia itself means an easy death. Some people say a mercy killing, but it's basically a way to control the end of life. Ultimately, the decision to euthanize is up to the client alone. Animals are considered property in terms of the eyes of the law, and it is completely up to the owner when it is time to euthanize. However, in reality, it should be a team decision. I am not shy about being honest with owners about when I think it's time to euthanize their patient. It is ultimately their decision, but I know when to really push, because I am an advocate for the animal and I have to be the voice for the animal. But it's something I would say, encourage the other veterinarian in your life to help you make that decision. Some decision to euthanize is straightforward. Sometimes it's made for you in terms of you have a traumatic injury or colic, acute illness, something that cannot be fixed. Sometimes we have really good data to say, I know exactly how likely a geriatric horse is to survive colic surgery. And I can give you numbers on that. And the people have done those studies. So we have great numbers to help make that decision in those situations. Sometimes finances are really the ultimate deciding factor, and that is also perfectly reasonable. Your horse needs colic surgery. Colic surgery is expensive. If colic surgery is the only option, then that makes the decision to euthanize a little bit easier. Sometimes, though, it's more complicated. So our non-emergency situations, we don't really have data to guide those decisions. That's when how do we know when to go? It can be really challenging. So there's multiple factors there. So horse factors, so chronic pain, disease, just the age of the horse alone. There's human factors, though. Sometimes it's not the horse that's the holdup, it's the human. It's hard for us to say goodbye. Sometimes finances are what really decides whether we euthanize or not. Sometimes it's convenience. And I don't say this in a negative way at all. I think sometimes we have to consider that it is too hard to have the horse, and that euthanasia is the best option. So one thing I like to bring up is hospice care. We don't talk about it in animals very much, but it is, once you've had people in your life who have undergone hospice care, I feel like it becomes a little bit more close to home, and something that I try to discuss with horses of geriatric horse owners. But I think we should think about how to provide our horses with a good end of life. So how do we kind of, before we're actually talking about euthanasia, how do we give them a good last few years or months or weeks? This is, like I said, because we can euthanize, oftentimes we don't even think about this, but it's becoming more common. I think people are kind of more interested in this topic. So we're trying to emphasize the quality of time the animal has left as opposed to the quantity. The goal is not for them to live forever. The goal is for them to have a good quality of life. So one thing I always ask is a shortened but pain-free life better than a longer but painful one? So this comes down to, if you need to go on a daily NSAID, I would rather my horse have a risk of side effects of GI ulcers or kidney failure. I'd rather have them I'd rather take that risk, but allow them to have a good couple years of pain-free life than to have them live in pain for the sake of not getting GI ulcer. I just know that if my horse develops GI ulcers, then that's my end point. That's when I say, you know what? Okay, we've got colitis or we've got kidney failure, and now it's time to end the horse's life, but at least we provided some pain-free years. So when is it time to euthanize? So one thing that you'll hear is kind of these platitudes, and this is not uncommon. It's no fault of anybody, but I've probably been guilty of saying these things, but she'll tell you when she's ready, or you'll know when it's time, or when they stop eating or start to lose weight. Or we'll say, let them have one more summer. Or you'll hear when their quality of life starts to decline. So all of these are all things that I've heard, I've probably said, and I'm sure you have all heard as well. But they're not very helpful. It's kind of vague, and it kind of leaves the client on their own in terms of knowing these things, which aren't really easy things to know. So one thing comes up is quality of life. What is quality of life? So quality of life is the aspects of the animal's life that make it better or worse for that animal or person. So as we discussed earlier, the ability to lead a comfortable life is the #1 factor in when owners are deciding to spend money on an expensive or long-term veterinary plan for their geriatric horse. So we kind of need to know what that means. So what makes life good? So from a human perspective, what I think makes a horse's life good is going to be somewhat anthropomorphized, which means I know what I like, so I assume my horse likes the similar things. I also know what is going to affect my quality of life as a human. So convenience of taking care of that horse, finances and ability to take care of that horse, and in caregiver burden, which is something that I'll discuss a little bit later. So what makes life good from the horse's eyes? What do they think makes life good? So they want to know that their basic needs are met. So that really evolutionarily means they have access to feed, they have access to water, access to shelter, and realistically the ability to reproduce. That's what evolution says a horse should be doing, is reproducing. So obviously we take that aspect away pretty early in most horses' lives, but that is what evolution says they need. But is that really enough? You know, these horses that we're talking about, these are part of our lives. They're part of our family. We know that a horse wants more than that. So maybe that includes beyond basic needs, they should have a low stress life. They should have relief from pain. They should have an appropriate social structure. So horses don't want to be in isolation. They want a safe herd where they're not going to be bullied. And then veterinary care. That is something that most of us as horse owners and veterinarians, we believe that horses deserve veterinary care. So end of life planning, we can be better. We can be more proactive about this plan. It should not be in the heat of the moment discussion that you have to have. We should be having these conversations ahead of time. And it should be a collaboration between the owner or owners, the family, and the veterinarian. This is a team approach. And I think there should be a plan. So the plan should establish criteria for euthanasia. That's important. So what factors are you going to use in your specific case to help make that decision? Should decide how the horse is going to be euthanized well ahead of time. So when it is time, when we decide to euthanize, how are we going to do it? And then what is going to happen to the body? So what are some criteria for euthanasia? So one thing to think about is when the needs of the horse cannot be met because of the disease is too severe, because there's lack of treatment options, or you've tried everything and nothing has worked. Those are all things to consider. Geriatric horses have unique needs. So they have all the basic needs of younger horses, excuse me. But then you might also have increased needs in terms of management of chronic pain, which we discussed, but also dental disease, specific nutrition needs, and then endocrine disease. So dental care, this is one thing that is really important for geriatric horses, and oftentimes it's only really addressed once weight loss is noticed. And this is likely well after the onset of pain and disease. It takes a lot of pain, dental pain, for a horse to not eat enough and lose weight. So it is important that we assess their mouths frequently. And if we can't, then we need to think about whether we need to euthanize them. Annual evaluations for geriatric horses is the minimum. Most horses who are 20 plus should get every 6 month oral exams and teeth addressed in most cases. Nutritional needs must be met. So many horses we know will outlive their teeth. So where they're living long, we have special diets just for horses without teeth, but it's something to consider as well. And then management of endocrine disease. So PPID really is the big one here. Many horses are on, as horses get older, they're more likely to be diagnosed with PPID. And as many of you know, PPID requires daily treatment for life with pergolide medication, which can be expensive. So another thing to consider is when the needs of the horse will not be met. And that is because, for whatever reason, the owner or whoever is not able to meet those needs, even if they could be met by someone else. So ideally, you would rehome that horse if that's possible. But sometimes that's not an option. Finances are definitely a consideration here. And then there are some people who are just non-compliant with what your recommendations are as a veterinarian. There's this idea of convenience euthanasia. And this is when really a horse is euthanized purely because the owner has determined they want to euthanize their horse. And it might be that they aren't that sick, or they don't have what you as a veterinarian or what you as another horse owner would consider euthanized, that they deserve to be euthanized or they should be euthanized. However, one thing to remember is that humane veterinary euthanasia is not the worst thing that can happen to a horse. I would much rather euthanize a horse because an owner can't afford to feed them and no one wants them than to let them suffer. That is one thing that I always remember. Euthanasia is not the worst thing that can happen to us. And so that's something to consider. And then the other criteria that is worth considering that isn't often considered is when human health is suffering. So there's this concept of caregiver burden, and it's really more talked about in the human field, because there's a lot more humans who are caring for other humans with a lot of needs. But it's kind of looking at how caring for someone or an animal with chronic health needs can affect the person caring for them. And it's a real thing that has been associated in people as having negative effects on the caregiver and on the person receiving care. So we often focus just on the animal, but we really you can't have a healthy animal without healthy humans taking care of the animal. So one thing to consider first, if human health is suffering, is can the animal be rehomed? Can you reduce the amount of care the animal needs? But if not, then euthanasia is a reasonable option. They actually have looked at this in dogs and cats with chronic or terminal diseases recently, and looked at caregiver burden, which I think is really interesting. And they found that caregiver burden is a real thing in people as well when they're caring for their chronically ill dogs and cats, and that more needs the animal had was correlated to symptoms of owner anxiety, depression, and lower quality of life. So I think it's reasonable to extrapolate this to our horse and assume that this can happen to horse owners as well. We do know that their horses are an emotion. We do have an emotional attachment to horses, and some more than others for sure, but it is a real thing. Right. So we have decided to euthanize our animal, and now we need to consider how the animal will be euthanized and what comes. So euthanasia laws will differ by state in terms of how animals can be euthanized and who can euthanize them, but most of them refer to the American Veterinary Medical Association's guidance, including Minnesota. This is what our state uses. And this is just kind of the approved methods. And many of you are familiar. The first one is IV pentobarbital. That's your euthanasia solution or anesthetic death that most horses are euthanized by. Gunshot or captive bolt, when done correctly, is another option. And then the other ones require the animal to have general anesthesia, and then some other options can be used, including intrathecal lidocaine, which has become more popular. You may have actually had a horse euthanized that way, but that horse would then undergo general anesthesia, so they'd be laid down, and then a spinal tap is performed to euthanize them with lidocaine. Other methods are unacceptable or considered unethical unless human lives are at danger. So there's always kind of that stipulation that if someone's going to get hurt, you do what you need to do. Disposal options will vary by state. I have a picture that in the next picture that will pop up, it does show a horse that is deceased. So if that is something that is unpleasant to you, you can just look away for the moment. But just to demonstrate, I think it's important to kind of have an idea and know what's going to happen before. You don't want the first time you see, this is the renderer truck picking up a horse. You don't want the first time you see that for it to be your horse. I think it is important to kind of have an idea of what that looks like when the renderer comes to pick up a horse, because that is one option for carcass disposal. And that's where this gets a little bit tricky. This is your special animal, but it's really hard to figure out sometimes what you're going to do with this 1,000, 1,200, 1,500 pound body. So burial is what most horse owners prefer when we have done a survey looking at that. And that's 61% of horse owners prefer burial if they can. The issue is that you can do it after any method of euthanasia, but the issue is that it's limited by land ownership and space. So if you're at a boarding barn, it's unlikely that the barn owner is going to want everybody to bury their horses on the property. There's environmental regulations you have to follow. And in Minnesota, it's really important to know what the water table is. And that can really vary depending on what county you're in even. And then season, what do you do in January? You can't bury it unless you have planned ahead. You can plan ahead and have your hole dug in the fall, knowing that you have a horse that may not make it through the winter. And then you maybe have a hole pre-made. But if it's a surprise or you didn't, there's no way you're going to bury a horse in January in Minnesota. So that's something to also is a real consideration. Cremation is another option. It can be done after any euthanasia method. It's got emotional appeal. We're comfortable with our pets being cremated. Sometimes here we'll do head, heart, and hooves. So it's kind of the important parts of the animal. It's very common in small animals to have our pets cremated, but it is unrealistic for most horses. It's not available everywhere. Not everyone can do this. And then it's very expensive. So especially when you're talking about whole body cremation, to cremate an entire horse is, runs at least $1 per pound. So it is expensive, and you have to be able to transport the horse. Rendering or the landfill, these is practical, traditional. This is how a lot of horses have been disposed of over time. It does not rely on, a lot of times they would come pick up the horse from the property, which is a practical thing that is helpful. It's less expensive than cremation. I have another picture here that shows the renderer picking up a horse. And it can be hard to watch, if this is your horse getting picked up the renderer. So I would say that, again, knowing what's going to happen. The problem is that lately, most renderers will not pick up chemically euthanized horses, which is with the euthanasia solution, because of concern over drug residues. So in Minnesota, this is definitely a problem that there are very few renderers that will pick up horses anymore. And so this is why one of the reasons that people are starting to use lidocaine more often as a method of euthanasia. Composting is another option, and I'm excited to talk about composting because I think it is a great option and something that I would personally choose over the others if I could make it happen. So it's been long used in production animal medicine. So when they've had these big outbreaks of avian influenza where they had to euthanize many, many animals, or on dairy farms when they have and they lose an animal, composting has been long used as a effective, cost-effective, and environmentally friendly method of euthanasia. So here we have done quite a bit of work. Our equine extension service we had a project looking at composting horses as a kind of whether it's a feasible option for our horses, and it is, and it's great. There are some issues in Minnesota if you do not have any commercial composting available. So we don't have any services that will compost horses yet, but you can do this on your own with your horse on your own property. So this is the website for the extension, and there's some great how-to resources right on the website. And then there's a class actually that goes on in January that will kind of shows you here is one of the how-to infographics that how to create a compost pile for your horse and all the things you need. This is what it looks like. So this is one in the project that I was part of, and kind of showing how we make the compost pile. So this is what you start off with. It's with easily accessible materials. So wood chips, and then this is, you know, horse manure, and the kind of horse goes right on top. And this is what it looks like on day 1. And then obviously you would cover, the horse is completely covered. And then this is what it looks like on day 216. So it takes a lot of time. This is the finished product. So that's the same pile. And that horse, you can't, the only things that are left are kind of the biggest bones. So the skull bones, the femur, that kind of thing. But otherwise, it's almost unrecognizable that there was a horse in there. And that is really, I think, just remarkable. It has been mixed a couple times, but otherwise the compost does all the work. A lot of people have environmental concerns about composting. What's really interesting to me is that, so we had game cams set up here so you can see there were coyotes, and they did not, none of them got into the piles. And that's because with composting, there should be no rotting, and so there should be no odor to attract scavengers. So they stay out, and that is what I think is really amazing, that they truly did not get into these piles at all. There's concern about drug residues. So these horses are euthanized with pentobarbital. Can you still compost them? And that was part of the project, and we found that the drug concentrations were detectable, but very, very low. And so this is an area of research that we're still looking at in terms of what could you do with that compost? Could you use it to grow plants? Could you use it in your garden? Or could you use it to plant a tree? I think it's really a nice idea to think that you can have individual composting of our horses and then use it as a memorial in some way. So that is something that definitely is an area of further research that you are welcome to follow. All right. I wanted to make sure I got through everything, so we had time for questions. And so I will open it up. I think Mindy has some questions, or we'll answer some questions now.
Okay. We've got several questions, Alex. We'll just see how many we can get to before 7
Sure.
here. How long can a horse safely take Equiox before they build up a tolerance for it?
That's a great question. As I mentioned, a lot of our older horses are on chronic Equiox for months and months and months. There's really no accumulation of it. It doesn't build up in the bloodstream, or there's no tolerance that develops. If the animal's no longer responding to it, it's probably just because their underlying disease is getting worse. Things like osteoarthritis get worse over time. We know that the NSAIDs the Equiox isn't going to stop that. So if it stops working, it's probably just because their disease got worse. But one thing I will say is that we still have quite a few people who, when we ask if they come in and we say, is your horse on any medications? They say no. And then later, when we're talking about maybe supplements, they bring up that their horse is on Equiox. And so I think it's really important to know that Equiox is an NSAID. It is closely related to butylamine, and that it definitely, I have seen multiple cases of side effects in horses that have been on it for a long time. So it certainly has its place, but it shouldn't be kind of your go-to for any horse with chronic pain.
Okay, thank you. Are there dietary factors that can help manage pain?
Yeah, I think the biggest dietary factor is just considering the body condition of the horse. So if we have chronic pain, a lot of times we're talking about chronic orthopedic pain or chronic foot pain, and having less weight and stress on those joints is really important. So trying to maintain a lean horse is great. There are certain conditions where diet is a much bigger factor. So when talking about our endocrinopathic laminitis, like horses with PPID, diet is going to be a huge part of managing that condition. And that's something that you definitely need to work with your vet on.
And what steps should I be prepared to take at the time if she goes down in her stall or in the paddock?
So another issue is that our older horses, especially in the winter, when we're slipping on the ice or if they're just go down and can't get up, that is always a scary situation for an owner. And I think one thing to remember is that sometimes it's because they can't get up, and sometimes it's just because they're exhausted. And so you always want to give them the benefit of the doubt and think that they might just be tired, and that you can certainly call your vet, but sometimes it just means that they need to be flipped over to the other side. Sometimes it means that they need food and water brought to them, or some IV fluids or pain relief before you try to get them up. But it's definitely an emergency if you have a horse that's down and can't get up, because we know that the longer a horse is down, the less likely they'll be able to ever get up.
Thank you. This actually was back to the Equiox again, Alex. Why would a vet tell you to use Equiox instead of Butte?
So the big difference between Equiox and Butte is that we know that Equiox is much safer for long-term use. So any horse that we think is going to be on an NSAID for a long time, Equiox is going to be a better choice. The issue is that it is less effective at pain relief because of that. And it's also more expensive. So you have to kind of weigh those pros and cons. If I have an owner who cannot afford or does not want to pay for Equiox for whatever reason, and I think that horse needs pain relief, Butte is better than nothing. Butte is a great, effective analgesic. It's great at causing pain control. You just have to make sure that you understand that it is more likely to cause adverse effects. So you have to make that decision. Is it better, if those adverse effects develop, am I prepared to euthanize my horse because it has ulcers or diarrhea or kidney failure if that happens?
Thanks. I just sent you a text. Your microphone's down again a little bit on your face.
Sorry, it kind of sags.
Yeah, figure I'll just tell you, it's easier. Let's see, retirement versus a slow, steady exercise in geriatric horses. What are the benefits or what are the downfalls?
Yeah, it's a good question. I think it's important, depending on what is wrong, that horses do benefit from regular exercise with osteoarthritis. We know that we've all probably been there. I've been there. That if you aren't moving enough, that can be worse for osteoarthritis. So you want a steady amount of exercise and kind of read the horse in terms of not overdoing it. The issue is a lot of people think, well, my horse is turned out 24/7. They've actually done studies to show that horses, when they're turned out, they don't really self-exercise. They're not really great at that. They mostly will just stand there and eat. So kind of having some type of exercise routine, whether it's just going on a walk or ponying them, even if they can't be ridden, I think that is definitely beneficial.
Yes, I've got one of those lazy ones.
Yeah.
What types of chronic conditions plague our older horses that often go unnoticed or undiagnosed?
Yeah, I think we covered some of those, but in terms of just whether you can see that the lameness is pain, and recognizing that, their studies have shown that owners don't necessarily recognize that their horse is lame or painful. So making sure that we have those horses actually reassessed and a lameness exam performed every year, or every time the horse your vet's there for their annual exam, watch the horse go, have them watch your horse trot, just to make sure there's not any lameness things that you don't need to address.
Well, we might actually get through these. Got two more. This is kind of a longer question, but do you have any tips for staying objective while observing geriatrics? The situation is I full care board retirees and observe them several times a day. I'm concerned I may miss gradual changes. My vets, body workers, and farrier are all comfortable talking with me about it. Anything they see, and I do look back at older photos and videos when I realize I should, but do you have suggestions?
Yeah, it sounds like that person already has a great team in place, and I think that's really important, and trusting what your veterinarian, your farrier tell what their opinion is of your horse's condition, because they're going to be better to be more objective. I think videos are great. I use videos all the time to compare. I think having some type of schedule for yourself, maybe I'm going to take a video once monthly or every 2 months and kind of look at it and compare side by side, so you can be a little bit more objective and kind of test yourself. But it's definitely a challenge.
Well, we have one more question. We're actually going to be on time. So this is a person that volunteers at a sanctuary, a farm sanctuary. They have a 30-year-old horse that never lays down to sleep. Sometimes she's so exhausted that her front legs give out. You know what that might be, or what can we do? And that's might be more, they might want to reach out to you for an appointment, but.
Yeah, so some people, we get this a lot, that people think their horse has narcolepsy. So horses don't have narcolepsy. Horses have sleep deprivation. We definitely recognize sleep deprivation as a real thing. And a lot of people know that horses sleep standing up, but in order to fully sleep, in order to go through REM sleep, they need to lie down. And when a horse there has to be certain conditions before they will lie down. And we definitely know that horses in the hospital don't like to lie down. They have to have the right environment. They have to feel safe, and they have to feel like they could get up and run away if a predator is coming. So they have to be in a herd situation, or there has to be a certain dynamic in the herd. And then they have to feel orthopedically sound. If I lie down and a lion's coming, I can get up and run away. And so horses, sometimes we think otherwise, but they are relatively smart in terms of protecting themselves, and in terms of knowing, like, I don't feel like I can get up very well, so I'm not going to lie down. And so then you get the sleep deprivation where they're kind of falling asleep standing up. And it's definitely a real concern, and something to kind of problem solve in terms of, why is this horse not lying down? What is preventing them from lying down, and trying to change the environment or address their pain in order to allow them to feel comfortable enough to lie down.
Okay. I'm going to sneak in one more question here, Alex. One just popped
Sure.
up. When a horse has just been diagnosed with Cushing's, but is not insulin resistant, do you still need to keep them off pasture?
Yeah. So there's a lot of overlap. I kind of wiffle waffle there, because the PPID is like a constantly evolving thing, and there are definitely horses that have PPID, and we assume the insulin dysregulation is a component of that in most cases, but maybe not all cases. I would say it depends on what testing has been done, and I would work with your veterinarian to kind of make sure, because we don't have perfect tests for insulin dysregulation. So it depends on what test was done and how equivocal it was. But I would rather have a horse that didn't get pasture than a horse that has foundered. So I'm always going to err on the side of caution there.